Okay, good afternoon, sir. My name is Jerry Crenel and Hernada, your student nurse for today. So, may I know your name, sir, your age?
My name is Franz Vincent Aralmina,
Okay.
19 years old.
Okay, sir. Where do you live, sir?
I live in San San Pique.
Okay, sir. Thank you. So, for today's assessment, I'll be assessing your mouth, your nose, your throat, your your ears, and your sinuses, sir. So, the purpose of this procedure, sir, is for us to determine if there are any problems with your senses, sir. So, do you feel yung mga hearing loss sa inyong family, sir? Or history? Okay. Tapos, do you feel sa past days, naka-feel ko ka-pain sa imong sa imong ears, mouth, nose, throat, and nose? Okay. So, thank you, sir. So, I have gathered here all the equipments. I will use this fork as a tuning fork, and this pen light as a otoscope, and I have here a gauze pad and a gloves. So I will perform hand hygiene. So sir, do you feel comfortable with your position, sir?
Yes.
Okay, sir. So for our first assessment, sir, let's start. I will be assessing your ears, sir. So the first is I will inspect your external ear structure. I will inspect the auricle, the tragus, lobule, and lobule for size and shape, sir. For color, lesions, or discharge, sir. Okay, sir. Let me observe now, sir. Okay. Okay, sir. Okay. Thank you. So, next is I will palpate your auricle and mastoid process, sir. Okay, I will palpate now, sir. Okay. Okay. So, sir, as I inspected your ear, I didn't see any problems in your lobule. The size of your ears are symmetrical, and it is normal, and it is in the midline, and the shape of your ears are also symmetric, sir, and the color is light brown, and I can see that there are no lesions or discharge. Okay, so as I palpated your ear, sir, do you feel any pain or any tenderness?
No.
Okay, sir, thank you. So for the next, sir, is I will inspect the external auditory canal with the use of my otoscope, sir. So let me just inspect, sir. Okay, yeah, again, sir. Sige. Okay, sir. Thank you. Okay, so next is I will inspect for your tympanic membrane, sir. Okay. Okay. Yeah. Okay, so as I have inspected your external auditory canal, sir, for discharge, color, and consistency, so I can see that I do not see any discharge on your auditory canal, and I can see that it is normal. And for your tympanic membrane, the color of your tympanic membrane is pearly gray, and the shape is normal, sir. So the next is I will perform, you will perform the Valsalva maneuver, sir. So can you please pinch your nose, sir, and then blow. Okay, sir, thank you. Let me just observe, sir. Okay. Okay, thank you. Okay, so the next is I will be performing the hearing test, sir. So the first step is the whisper test. So I will cover your ear, sir, and then just tell me if you can hear what I've said. The two-syllable word, sir. Okay.
Basketball.
Okay, thank you, sir.
Baseball.
Okay, sir, thank you. So for the whisper test, I can see that that you've responded to me accordingly to what I've said. So the next is the Weber test, sir. By the use of my tuning fork, I will just tell me if you do you hear the sound on your both ear or your right ear or left ear, okay? Okay, you hear sound, sir? On both ears or left or right ear?
Yes, sir.
Both ears, sir? Okay, thank you. So the next is I will perform the rhyme test. So just tell me, sir, if you can hear, you can hear if you can hear the sound stop, okay? Just tell me, sir, okay?
Okay. Okay.
Okay, sir, thank you. So you've responded accordingly to what I have performed, sir, which is good. So the next is the Romberg's test. Okay, can you please stand up, sir? Okay, can you please cross your arms on your chest and close your eyes for a second, for just 20 seconds. Okay, sir, thank you. You may now sit down. So I can see that you cannot that you've responded accordingly to what you have performed, and when I performed the Romberg test, you were stable, and do you feel any dizziness, sir, or anything?
No.
Okay, sir. Thank you. Okay, that is for the ear assessment. Okay, sir. For the mouth assessment, for the next assessment is the mouth assessment. Okay, sir. I will, as I have observed, I did not see any. I did not see any distinctive odors. So the next is I will palpate and I will inspect your lips, buccal mucosa, gums, and tongue for color, sir. So I will use gloves to. Okay, my God, sir. Are you comfortable?
Mm-hmm.
Okay. Thank you. So I will palpate your lips, sir. Okay. 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 Can you please say ah? I will inspect your gums, sir. Okay. Okay. Don't worry, sir. The gloves are sterile.
Mm-hmm.
Okay. So the next is I will inspect your tongue with the use of gauze pad. Okay, the next, sir, is I will inspect your teeth for number and shape and color. Okay, can you please smile, sir? Okay, thank you. Okay, I can see that there are no any, or in our own dialect, nagabutan, sir. And I can see that your teeth are complete, and it is very white. Not actually white, but it is in a healthy healthy condition. Okay, next I will inspect and palpate tongue for color. Okay, by the use of gauze pad. Okay, can you please let your tongue out, sir? I will put this to gauze pad. Okay. Okay. Okay, sir. Thank you. Okay, as I have seen in your, as I have inspected and palpated for your tongue, the color of your tongue is red, and the texture is rough. The texture is rough, and the consistency is good, sir. Okay. Next is I will Next procedure is your throat, sir. Okay, I will inspect the throat for color and consistency. Your uvula. Okay, can you please say sir? Okay. Okay, tongue out, sir. Okay, thank you. So I can see that it's normal. There are no presence of any tonsils or anything. There are no presence of any discolorations or in your throat. Okay, next is I will inspect for the tonsils for color and consistency. Okay. Can you please put out your tongue? Okay, can you please say sir? Again, sir? Okay. Okay, sir. So, as I have inspected your tonsils, it is okay, sir, and there are no problems with your tonsils, and it is functioning well. Okay, for the next, sir, is I will inspect your nose, sir. I will just inspect your nose for color, shape, and consistency. Okay, sir. I will palpate, sir, your nose, sir. Okay. So, as I have palpated your nose, sir, do you feel any tenderness or pain, sir?
No.
Okay, sir. So, the color of your nose is aligned with the color of your skin, which is light brown. And it is symmetrical, and it is in the midline. So, as you have said, you don't feel any pain or any tenderness as I have palpated, so which is good. And can you please cover your nose, your left nose, okay? Can you breathe? Inhale, exhale. Okay, again, sa piyak ulit, sir. Inhale, exhale. Okay, and I can see the airflow in your nose is functioning well, and it is good. Okay. Next, I will inspect your internal nose for color and swelling or bleeding, sir. Can you please tanga lang gawa, sir? Okay. Okay, sir. Thank you. So I can see that there are no any bleeding or any swelling inside your nose, sir, which is good, sir. So the next and last step is your sinuses, sir. I will palpate the sinuses for tenderness, sir. Okay na, sir. Matouch ako sa inyo na, sir. Palpate ko yung sinuses. Okay. Okay, sir. Thank you. Next is I will percuss and trans-illuminate the sinuses for air versus and fluids or pus, sir. Percuss ko lang, sir. Okay, sir. Thank you. So, as I have palpated your nose, sir, your sinuses, sir, do you feel any tenderness or pain, sir?
No.
Okay, sure. As I have percussed, it is functioning well, and the fluids and the pus. Okay, so that ends our procedure and our assessment. Are you comfortable, sir, with our assessment?
Yes.
Do you wish to go to the CR or anything as I can make you comfortable?
It's okay.
Okay, thank you, sir. Everything's okay. And then, overall, the assessment, the result of the assessment is all senses are normal. I can see that you have a healthy and well-maintained mouth, sir, especially the teeth. Okay, as I can advise you, sir, healthy lang kita natin dapat we maintain the oral cleansing patas ka ating mababa. Do you wash any do you use any mouthwash?
No, sir.
Okay. So if you wish to use mouthwash, just refrain from using it too much, sir, so that it won't damage your mouth, sir. Okay, sir. As I asked you earlier, you're comfortable, and I will document the findings, and this assessment is between me and your attending physician, sir. So for the last step is I will perform hand hygiene, and I will document the findings. Thank you.